Cold and flu season's on its way. There's lots of nasty bugs out there. There's one you need to know about. It goes by the initials RSV. Come right back to learn more. Today's episode is brought to you by Baby Bjorn and their new Baby Carrier Miracle. Same great Baby Bjorn design, even greater comfort.
RSV stands for respiratory syncytial virus, and respiratory syncytial virus is the cause of a very frequent infection in babies and children actually under the age of 5. The RSV infection is an infection of the upper respiratory and lower respiratory tract. To a large extent, the signs and symptoms of that infection depends on your previous exposure to it. It's an interesting infection because you can get infected with it over and over again. Just because you've had it one time doesn't mean that you can't get it again. The issue is how you respond the first time you get the infection. RSV infection actually can occur all throughout your lifetime, but certain populations, certain ages are at highest risk. And for children, most children are infected by age 2. Amongst that, there are lots of vulnerable populations, and those are especially the children that are preterm, that can be born up to 35 weeks of age, gestation, children with congenital heart disease, children with chronic lung disease, children with immunosuppression, certain children sometimes with other factors that can affect their breathing or their lung function, cardiac function, etc. But really, the preterm infants are the highest risk for this infection. And the reason that they're at highest risk for this infection is because of their immune system, which is so vulnerable, as well as their lung anatomy just hasn't had time to develop and develop into more of a functional system by the time this infection can happen. So children that are at the greatest risk really are those that fall into those groups that are born at the time that this virus infects or affects our population, which happens seasonally. It happens every year in the winter months. It usually happens somewhere around November, usually lasts until around March or April. RSV is an important virus in the wintertime for multiple reasons. It's spread from child to child, so hence children that attend child care centers, daycare centers where there's other children that may be ill are at risk for RSV. In addition, children that reside in homes that are smokers, where there are smokers or their smoke it's been shown that smoking is an risk factor for many infections, not just RSV. Children with other siblings at home who can bring home things may have also a bit of an increased risk for RSV. The other thing is that this virus can also be on environmental sources, such as toys. The first thing you should do if you thought your baby had RSV is take your baby to the doctor. It is easily tested for in most situations. And in many situations, the diagnosis can be given to you within a few hours. Hospitalization is not always necessary. We reserve hospitalizations really for the sickest babies, the babies that either have underlying problems that I mentioned or are already in trouble with breathing difficulty, low oxygen levels. The question of trying to prevent this infection is a very important one because it really is one of the few viral infections that we can do something about to prevent. There is a substance which is an antibody response against this virus, and this substance is called Synagis. It is given annually in our country. It is given to babies that are vulnerable and are at highest risk, and it's given at usually 5 doses. The question was, what can you do as a parent if you feel that your child should qualify for this substance and you're denied by your insurance company? I think your greatest advocate really is your doctor. Your doctor should determine whether your child falls into those high-risk criteria. It is a very expensive resource, and there can be times when the physicians can go to bat for their patients, and all insurance companies have people that you can speak with and explain your issues, but your physician should be your greatest advocate for that. The Centers for Disease Control always has good patient education information about various infections, and RSV is definitely one of those. The Centers for Disease Control is one good site to get seasonal epidemiologic updates, as well as some practical things to do to care for your child, etc. American Academy of Pediatrics also has a very good website.
I know a little bit about RSV. My oldest was a premature baby, and he took Synagis shots for the first 18 months of life. It protected him very effectively from the disease. Of course, once he went off the shots, he contracted RSV and ended up in the hospital. It was New Year's Eve of 1999. That's right, we spent Y2K in the hospital with my son. But by that time, he was big, robust, and healthy, and was able to manage RSV without having any tragic circumstances. If you've got a vulnerable child, talk to your doctor, learn more about RSV and Synagis. That's all for us this week here in the lab.